everyone, this is Maggie again. On my channel, I usually discuss topics related to blindness. However, in this video, I would love to share tips that may be useful to psychotherapists who, because of the coronavirus pandemic, have to transition from working in face-to-face setting into working over the phone or video links. Firstly, I will discuss things that we may need to take to consideration when preparing for remote work. Secondly, I will discuss various ways in which we may be able to support our clients in receiving treatment over the phone or video call. Finally, I will discuss things that we may need to take to consideration during the session that is delivered over the phone or over the video call. Before I start discussing these topics, I wanted to share with you some information on my background, and I hope that this information will enable you to decide which parts of my experience are relevant to your situation and which information may be useful to you. So I completed Masters in Psychology in Poland, and after graduating from university, I moved to the UK, and from 2010, I work for the NHS. Initially, I worked as honorary assistant psychologist. Then I worked as psychological well-being practitioner. And for those of you who are not familiar with that term, psychological well-being practitioners deliver low-intensity psychological interventions that are based on CB model to clients who experience mild to moderate symptoms of anxiety and depression. This experience is particularly relevant to that video because whilst working as psychological well-being practitioner, I had a lot of opportunity to deliver interventions over the phone and over the internet. Currently, I work as a CBT therapist, and CBT therapy is delivered in face-to-face setting. However, because of the fact that I am completely blind, I had to develop many strategies that enable me to deliver CBT without having any visual information. And I hope that these strategies that I had to develop for myself will be useful to you in this difficult current situation. So, first of all, it is very, very important to remember that we all need to follow the guidelines, policies, and procedures of professional bodies and of our employers. I am sharing today information with you as your colleague, but I don't represent views of professional bodies and don't represent views of the NHS. So what I share with you is my private experience that I share with you as my colleague, but we all need to follow the guidelines and procedures that are introduced by our employers and by professional bodies. The next tip that I wanted to discuss is reflecting on people who are on our caseload and reflecting on who would benefit from continuing the treatment over the phone or over the video call, and who would benefit from having the treatment paused and continuing after the situation goes back to normal and we are able to continue with face-to-face sessions. Over the last week, online there were published many articles that give some suggestions regarding this. So it is suggested that continuing EMDR would be not beneficial for clients, and that, for instance, completing relieving with clients who work on overcoming trauma would not be beneficial. For clients with whom we work on overcoming symptoms of PTSD, it may be beneficial to work on stabilization and preparing for later stages of the treatment. But as I mentioned, relieving may be not beneficial over the phone and over the video link, and it's not recommended. It is also necessary to consider whether behavioral experiments may be completed over the phone or video call. So definitely, if we work with somebody who experienced difficulties, and when we support the client with overcoming these difficulties by going out to town or some public places, these behavioral experiments cannot be completed under current circumstances, because according to current government guidelines, we all have to make sure that we practice social distancing and, if necessary, social isolation. So this treatment needs to be paused. We need to reflect on which behavioral experiments, and if any, may be completed over the phone or over the video link, but that will probably depend a lot on the type of experiment, on the person that we work with, on our situation, their situations, and many other factors. So these situations need to be considered individually. The next tip that I want to discuss is preparing materials. So it may be helpful to prepare and deliver to clients materials in advance, because sometimes it may be difficult to predict what exactly we may need during the session. So it is important that we are covered and that we have sent materials that we anticipate we may need. It is also very important to consider the format in which we prepare the materials, and we need to ensure that we prepare materials in the format that can be accessed by the clients. So for instance, large print for people who may have low vision. If we need to do any other adjustment, it is also important to consider them. It is also important to remember that if we decide to email or text some materials, that the clients will be able to open the files, and that the files will be that the clients will be able to edit the files. For instance, when completing, I don't know, thought diary, 7-column worksheet, or maybe formulations. It is also very important to consider how we are going to send these materials to clients. And if we decide to post the material, it is important to remember that currently post offices may be under a lot of pressure, and this is why we may choose to email the materials or send them by text messages or any other internet channels. But if we are sending paper copies through the post, it may be important to check whether we have consent from the client to send letters to their home address, because some clients maybe didn't share the fact that they are in treatment with their families and friends, and may not wish to receive post to their home address. If we are sending materials over the email, it is also important to verify client's email address. Now, the second thing that I wanted to discuss is preparing our workplace. So it is very important, in case we worked from home or from some other location which is not our clinic, to ensure that we have confidential space and that we are able to maintain confidentiality. It is also very important to ensure that we have quiet and comfortable space so we can focus on our work and deliver high quality of sessions, and that also clients are not distracted by any noise in the background that they may hear over the phone. If we are delivering sessions over the video call, it is also important to ensure that the background on which clients may see us is neutral. It is also very important to consider what equipment we have available. If we need to work using our private phone, it is necessary to withhold our number, and if we're using the work phone, that will depend on your workplace policies and guidelines. It is also important to consider getting access to headphones, because holding the phone in your hand may be very tiring, and that may make it very difficult to make notes. When working remotely, it is also really important to remember about well-being of our colleagues who also work remotely and who may find it very difficult. Now, I would like to move to the second part of this video, and I would like to discuss ways in which we may be able to support our clients in receiving treatment over the phone. So, in the first place, it may be very important to provide our clients with thorough rationale behind the change of the mode in which treatment is delivered. And if we have new clients, we need to discuss with them and check how they feel about having sessions over the phone or over the video link, because these clients were expecting face-to-face sessions. So providing them with thorough rationales about current situation and about rationale behind this change may be very important. It is also important to offer people space to express their feeling regarding the situation and this new mode of working, to express any concerns that they may have, and to answer any question that people may have regarding current situation and the form in which they receive the treatment. It is also very important to discuss potential barriers that clients may experience when receiving treatment over the phone or over the video link. So, for instance, we need to consider that our clients may not have access to childcare and may struggle with arranging childcare. Some clients may also struggle because they simply don't have confidential space at home, and they don't have any place at home or in their flat where they could freely talk about their difficulties, their feelings, their thoughts. I have heard one good tip that apparently also came from one of the clients, and that was shared online, that some people thought about sitting in their cars, because of course the car would ensure confidentiality, but we need to remember that situation keeps changing, that some of our clients need to self-isolate, and walking to their drive and sitting in the car may be not possible. We also have to consider whether people have any disabilities that may make difficult for them to work over the phone or over the video call. Another thing to consider is clients is working with interpreters, and it may be possible to arrange like video conferences or phone conferences with the interpreter, but this will definitely require more work and more preparation and more considerations. It is also very important to support clients in preparing for sessions and support clients to prepare for phone calls or for video calls in the same way they would prepare for face-to-face session. So it is very important to highlight, for instance, the fact that it is important to have pen and paper so people are ready to take notes, complete materials, etc. It is also important to highlight that people will benefit from having the material that was used in past sessions, because we often refer to past sessions, to have the materials that were prepared for this particular session, but also any other material that you would share with them, because as I said, it may be sometimes hard to predict which exactly worksheets we may need. It is also very important to support people with preparing in that sense that they are in comfortable place so they can focus on discussed topics and materials. Another thing that I wanted to mention is the fact that we may need to look again through the contracts with our clients and consider things that may need to be added to the contract or may be rephrased. And for instance, it may be very difficult to recontract again rules and regulations and recommendations regarding DNAs and cancellations. So naturally it may be necessary, especially during this initial time when people are kind of readjusting to this new situation and, for instance, organizing their childcare, to maybe be more flexible with cancellations, or in case of illness it also may be important to be more flexible with cancellations. However, this kind of additional flexibility, it may be basically helpful to recontract any changes that we would introduce to the way we were kind of coping with cancellations and DNAs. And it is also very important to support the client with being on the same page about the fact that once we have recontracted our recommendations for cancellations and DNAs, we will be treating DNAs and cancellation in the same way as if we would treat them in our face-to-face clinics. So for instance, it may be helpful to share with clients that when the call is not being answered, no matter whether this is phone call or a video call, this may be treated as a DNA. And also it may be helpful to share with the clients that we would still find it helpful if the sessions, if they could cancel the sessions 24 hours in advance. On that topic, I wanted to mention one additional thing, that of course now people may experience many technical difficulties, so it may be very helpful to call a client on agreed time, and if possible to leave a message, and to call the client again in 5 minutes and then again in 5 minutes, and explain that we will call the client 3 times every 5 minutes. So we give people opportunity to resolve any technical issues that they may experience. But then it may be also helpful to share that after third unanswered call, the session will be clustered as a DNA. I hope that it makes sense. And now I will move to things that about things that may be useful to take to consideration when we deliver the session over the phone or over the video call. So basically things that we may need to consider during the session. So in the first place, make sure that clients are aware of the fact that you may be calling them from withheld number, because some people don't answer withheld numbers. So it is important to arrange to have this conversation. Second of all, it is important to remember that when we phone a client, it is not necessarily the client who will answer the phone. So before we reveal our full identity, it is important to check identity of the client who answered the phone. So I will, of course, some family members may find it anxiety provoking. So for instance, it may be a good idea to give the first name. And for instance, if you work for the NHS, you may mention that you are calling from the NHS. And it may be also helpful to offer people reassurance and explain that this call is not urgent, is about nothing important, and that we will call the client again later or send a letter or whatever arrangement we would have. If you are employed by other employers, you may find other ways of introducing yourself without revealing that you are a therapist and that you are calling from mental health service. Because again, some of our clients are not necessarily sharing with their families that they are in the process of treatment. Many people confirm client's identity by asking questions about, for instance, date of birth and first line of the address. The second point that maybe it is a third, I closed the count. Another point that I wanted to share and which may be important to consider is agenda setting, and it may be very helpful to consider any questions that clients may have about remote working or about the current situations, and to plan for discussing these questions in the agenda. Another thing which is really, really important, and that is linked with the fact that even if we work over the video call, we may have limited access to visual information. So for instance, we may not see full person, so we may be not fully aware of their body language, or it may be hard for us to see their notes or the materials that the clients are looking at. So now I will share some strategies that may be helpful with overcoming the difficulties that are linked with having limited visual information. So in the first place, it is very important that we remember that, especially when we work over the phone, people don't see our body language, they don't see our facial expressions. So we have to make sure that we express empathy and other emotions verbally. So it may be even more important to emphasize that we understand what the client is saying to us, that we empathize with them. If we hear that the client is distressed, sometimes in face-to-face setting, we would express our empathy by handing over some tissues or making gestures that suggest that people may take some time. But over the phone, we need to verbally signal that we hear that they are finding this discussion difficult, and for instance suggest whether they may need more space, more time on some very, very short, some break before we continue with the session. It is also very important to remember that we will be able to see emotion in the voice. So please don't worry about the fact that you may be not aware of clients' emotions, because from my experience, emotions are, I would say, maybe easy to realize from the tone of voice. And also you won't be distracted by visual cues, so you will be more focused on the voice, and that will help with kind of listening to changes in tone of voice or way of speaking, or other sounds that you may hear in the background, like for instance crying or people reaching for tissues, etc. Because we will have limited access to visual cues, it is also very important to offer feedback even more frequently than you would normally do it, and also ask for feedback more frequently than we would normally do it, because it is very important that we have shared understanding of discussed difficulties, discussed topics, discussed strategies. And because lack of visual cues may make communication harder, we have to put extra work in giving in and receiving feedback, summarizing, etc. Then another thing that I wanted to mention is collaboration, and it may be very, very helpful to be open and honest about the fact that working remotely is new for both of us, for us and for clients. And it may be helpful to discuss any difficulties or any barriers as openly as we can, and that will give us space to work on overcoming them in a collaborative way, which I believe may only strengthen therapeutic relationship. It is also important to remember that the pacing of the session may be slightly different, because we may need more time for instance, giving feedback, receiving feedback, or for instance, describing verbally diagrams, worksheets, and etc. So we may have to also readjust pacing of the session. I also would like to mention that we may need to be very mindful when working on homework setting, because we may need to consider what is and what isn't realistic in current circumstances, what can be achieved at home, and when we have very limited ability to go out, socialize, and etc. So it may be especially important to consider any changes we may introduce, for instance, to people who work on overcoming social anxiety, or for people who work on behavioral activation, or, as I mentioned before, some types of behavioral experiments. The next thing that I wanted to mention is the fact that when discussing and working on materials, for instance, formulations, other diagrams, worksheets, we may need to use very descriptive language. And this is what I do in my sessions. So we need to describe first of all, it is very helpful to make sure that we have the same material in front of ourselves that clients have, okay, that we're discussing the same worksheet. Then we need to describe the diagram or worksheet basically in a lot of detail, and probably you will readjust it depending on the client and depending on yours and their abilities to follow the description. And it also may be very helpful to make sure that clients use descriptive language when describing things back to you. So, for instance, you may ask, okay, so what can you see on the top of the page? Or what can you see if you follow the arrow from the top to the right? Or you can say, what can you see in the, like, say, third column from the, in the first column? Make sure that you are looking at the same column and the text. make sure that you are looking at the same part of the diagram. I hope that it makes sense. And here probably we need to be creative and patient with ourselves, because initially that can be challenging. The next thing that I wanted to discuss is conducting risk assessment. And I know that for many therapists who didn't have so far much experience of working over the phone, that can be quite distressing experience, because if having limited visual clues, it may be harder, and also having this knowledge that we are not there with the client to support them may be hard. So it is still essential to conduct risk assessment. We may need to be more careful and even more. I know that we are careful and sensitive when we raise this difficult topic, but we may have to put extra work in when conducting risk assessment. And if in the situation, if the client was very distressed and maybe hung up on us, we may need to remember about the fact that, first of all, let's follow the procedures and policies for your employer. But some people may be not aware of the fact that we may contact the police and ask them to go to client's address and do so-called well-being check. And I am sharing this tip, but I'm also aware of the fact that now when the police is under more pressure and they're very, very stretched, I don't know how possible that will be and whether they will be still able to support us in that way. But it may be possibility, and it's remember about this option and to check whether this is available, and that may be very helpful in case we lost connection with the client and the client wouldn't answer our further calls. The last thing that I wanted to mention is materials that are created and related to current situation of coronavirus pandemic. And online you will be able to find many materials on how, for instance, to support clients with managing worries during these difficult times, how to support clients who suffer from OCD, health anxiety, social anxiety. There is more and more materials every day, and you may wish to go online, research these topics, download these materials and share them with clients or use them in your practice. I hope that you have found these tips helpful. I'm sorry that it was super long video and that I was maybe sometimes mumbling and confusing you a little bit, but I really try to do my best to share those tips with you. I wish you all the best for this difficult time. Look after yourselves, and I will see you soon in the next video. Bye bye.